Welcome to Parent Squad. We know every journey to parenthood is different, and for some, creating a family can be a difficult experience. Today I'm joined by IU Health OBGYN Dr. Sarah Carpenter to talk about options for dealing with infertility. Dr. Carpenter, thank you for being here.
Thank you for having me.
Yes, I have my own fertility journey, so I know firsthand how difficult this can be. We ended up doing IVF, and we have a beautiful little boy right now. And it can be really affect a lot of couples trying to conceive. Infertility is common.
It does. It's very common, yes.
Okay. So is there any sort of testing that should happen before trying to conceive?
So in women who have regular monthly cycles and don't have any challenges that they know of pre-existing, there's no pregnancy-specific testing that's needed prior to trying to conceive, but I recommend that all women see their provider before they start to conceive so that they can make sure they're as healthy as possible when they're planning a pregnancy. We always want to make sure that women don't have pre-existing medical conditions like diabetes that could impact the health of their pregnancy, and also make sure that they start taking folic acid before they conceive to help prevent things like spina bifida.
Because we're talking about the health of the baby as well as the health of the mother.
That's right.
Can you tell me how long do you recommend someone try before being diagnosed with infertility, and what does it mean?
Yeah, so we define infertility as somebody who hasn't conceived within 12 months of starting to try to get pregnant, so actively trying to get pregnant and not taking birth control. That's for women who have regular monthly cycles and are under 35 years old. We know that fertility is really related to age in women. Unfortunately, we're born with all of the eggs that we'll ever have. And so as we age, the likelihood of conceiving spontaneously does decrease. In women who are over 35, we would recommend you see a physician if you haven't conceived within 6 months.
Okay. And then what about women over 40? We know that age keeps rising, and the commonality of older moms keeps rising.
That's right. So I'd say if you're over 40, it would be good to see a physician certainly before you start trying to conceive, again, just to help make sure that you're as healthy as possible going into the pregnancy and before the pregnancy. We don't have a different guideline for what defines infertility in women over 40, but they would fall into that over 35 category. So after 6 months, they should certainly seek treatment.
Okay, so you kind of have an idea of the timeline and what things look like. I have a few friends who are trying later and later. And we know that there's some pre-existing conditions that can impact fertility. Let's talk about some of those and what can be done. I know you just mentioned diabetes. So
some of the things that are really important to the health of a pregnancy are maternal conditions like diabetes or hypertension, also things like seizure disorders or medications that could impact the well-being of a baby and the development of a baby. So all of those are things that we would recommend seeing a physician before starting to try to conceive. It doesn't mean women shouldn't get pregnant, and we don't encourage people to just stop medications before trying to get pregnant. We want them to see us and talk about it, but we want to help optimize the health of a mom and also the health of a baby.
And do you have any tips for helping track ovulation? Obviously, when you're trying to conceive, there are a specific window that you're trying to hit.
Yeah, so most women that are having regular monthly periods are ovulating because ovulation is actually what drives having a menstrual period. So if you're having a regular monthly period, you are probably ovulating. If you would like to track it, we expect that most women will ovulate around day 14 of their cycle, where day 1 is the first day of bleeding. If they'd like to do testing, you can get ovulation predictor kits over the counter that are urine-based tests. We recommend starting those a couple of days before day 14 of the cycle, and you can track and see if you're ovulating.
I love that we're talking about this because I think it's so fascinating how little we know about our bodies, particularly as women. I look at how much I knew, then when we started our fertility journey 5 years ago. The baby's 2 now. And I look at how little I know then and how much I learned in the process. And just to understand what your body is doing every month, or at least what it should be doing.
Absolutely. Yeah. I think a lot of the things that we talk about when women are planning pregnancy, even if they're not having infertility per se, is just helping them understand their bodies. And that's the benefit of a lot of the tracking apps or tracking systems, is that it helps women understand what their normal is and know when to expect ovulation.
There we go. Is there any truth to being certain times of day better than others that you should be seeking to try to conceive?
Yeah, I wish it was that easy. It's not. Unfortunately, a lot of the things about time of day or positions or things like that, they're not really true that we know, at least from research. research.
Old wives'
But,
tales.
yeah, it doesn't hurt,
Yeah.
but it's probably not going to help.
Yeah. And then are you seeing more conception struggles in your practice? And what would you attribute that to?
Well, like you said, it's more and more common for women to delay pregnancy until later in life. And, again, it's certainly not because we want it to be harder, but unfortunately, biologically, it is just harder to conceive when you're older. And so we do see more of that. We also see more and more women having diabetes or hypertension or other medical diagnoses when they're trying to get pregnant. And so it's extra important to think about those things before trying to conceive.
Okay. We've covered a lot here, but what would you, I guess I want to speak specifically to the women that are 35 and up, 40 and up, and they're trying to conceive because we see so many success stories on social media. However, the science is still the science.
That's right.
And so I do want to address that because you see a lot of people doing it, but I think there are also a lot of unfortunate stories, sad stories that we don't see on social media that's being left out of the narrative.
Yeah.
What would you want to say to that 35-year-old who might be single, maybe they have the partner, maybe they don't have the partner, but they still want to have a baby, or the 40-year-old who might be in a position like that?
Yeah, so I would encourage them to talk to their physician, and OBGYN especially, and to talk about what their goals are. There's always options. I think the thing that we don't see on social media is always what it took people to get to the happy ending. So we see the happy ending, but we don't always know if people went through IVF or if they used donor eggs or if they used other reproductive technology to help them conceive. And we do have lots and lots of different options. So I think kind of establishing what your goal is and what is the healthiest way to get there is a really important starting point.
If someone is 35, does that mean that they need to, and they don't have a partner in sight, does that mean that they need to run out and freeze their eggs?
They don't have to. They certainly could think about it. That's a really personal choice. I think that if they want to have sort of a backup plan or, extend their fertility, we see more and more professional women that are choosing to freeze their eggs when they're younger because we know that the likelihood of spontaneously conceiving goes down with age. And the earlier you freeze your eggs, the more likely they are to be viable for a pregnancy. So that's a choice, but it's also an expense and it's a stress and it's something you have to physically go through. So, we certainly can talk about all of the options that exist, and that's one of them.
Certainly. We also know that Indiana consistently has one of the highest infant and maternal mortality rates. Is there something that you could think can be done to not only bring awareness to that, but also to combat seeing the numbers that we're seeing?
Yeah, I think I've said it a few times, and it's one of my favorite topics to talk about. I think helping women be as healthy as possible before they try to conceive is really important. We're all whole human beings, whether we're talking about pregnancy or not. And so seeing a physician on a regular basis, making sure all of your healthcare screenings are up to date for cancer and for other things like diabetes, hypercholesterolemia, making sure that anything like that needs to be treated is treated. Because by the time you're pregnant or you're pregnant, we don't have as much time to try to reach a diagnosis and then help people be as healthy as possible.
And I understand that you are OBGYN, but any message to male partners that are out there? Obviously, women are only 50% of the journey that we have here, but our men need to be aware of their health too.
Absolutely. I think if men are wanting to think about having a pregnancy, stopping smoking, stopping using marijuana or other substances, making sure that they're as healthy as possible, and also not being afraid to participate in the journey with their partners. Often a part of infertility testing, even though I'm an OBGYN, I will talk to patients about things like semen analysis. And sometimes that really surprises partners that we're talking about it. And so I think being willing to have those conversations and to do that part of the testing, because we don't want to treat a woman and then find out that the sperm are the issue.
Yes.
Then we wasted a lot of time, a lot of money, a lot of heartache when we could have done something else from the beginning.
Yeah. Well, I'm shocked that you said some of those patients are shocked. As though they're not 50% of what's happening here. It's certainly you need to tango, particularly with a topic like this. It's so eye-opening how little we know about our bodies as women, and I can only imagine where a man stands on that spectrum, how little they too know about women's bodies. And so my husband learned so much in the journey and was aware of so much more because he was brought into the room and because we had this journey together. And so I encourage you to talk to your partner and do your best to be open and have some of those conversations, because it can be a tough journey.
Absolutely.
And how awesome it is that you two can do it together. You and your partner and your family can do it together. Thank you for being here. I know we only scratched the surface of your medical school and residency, but hopefully this is a jumping off point for a lot of families so they can have the conversations that they need to be having, a lot of women out there. Thank you so much, Dr. Carpenter.
Thank you.
If you want to find more info, you can head to parentsquad.com, WTHR.com/parentsquad, I should say. We have more ahead, so stay with us.